Assalamualaikum. My name is NURULAIN FARHANAH. Me and my friends will present today based on our PBL 1 toxicology before this. From both trigger, what we can summarize is the 23-year-old male which involved in illegal party have emergency complaint about palpitations, chest tightness, dizziness, and headache. And he lied about taking drug as in trigger. Uh, he then confessed about inhale something which suspicious, and we assume it is as recreational drug, and specifically marijuana. So firstly, what is recreational drug? Recreational drug is drug that has been taken by individual for the purpose of enjoyment, and it usually cause bad effect as they taking without limitation or overdose, cause addiction problem, cause addiction problem toward community, and also health problem. In recreational drug, we have 7 categories that we can find. So firstly, we have central nervous system depressant, and as example is alcohol and also barbiturates. This type of CNS depressant can slow down the operation of brain and body, which cause sleepy, poor concentration, confusion, or slow breathing. Next, we have CNS stimulant as examples, cocaine and also amphetamine. So from the name itself, we know that it actually stimulate and accelerate heart rate and overstimulate the body, which all of this could cause a heart attack, suffocation, or brain damage. Next, we have hallucinogens, which from the name itself, we know that it causes hallucination or the user perceive things differently than they actually are. And as example is LSD. And then we move to the dissociative anesthetic drug, which this kind of drug inhibit pain by cutting off or dissociating the brain's perception of the pain. And as example, PCP and dextromethorphan. Next, we have narcotic analgesic, which relieve pain, which this type of drug help to relieve pain, induce euphoria, and also create mood changes in user. As example, here we have heroin and also morphine. And then we have inhalants. So from the name itself, we know that this is the substance, the drug, the kind of drug that we inhale. So it is a breathable substances which cause mind-altering results and effect, such as gasoline and also pain thinner. And the last one is cannabis, or the other name is marijuana. It have active ingredient which is the delta nitetrahydrocannabinol, or THC, which is the agent, the psychoactive agent, or also called as mind altering agent. Marijuana usually can be taken by inhale marijuana smoke, and the smoke itself will cause effect to the specific receptors in brain. And then we have effects of recreational drug, but the important thing is the effect is based on the drug that the individual take. So now I will pass this presentation to the next presenter.
So, based on the trigger, the man confessed to inhale something at the party, right? So we assume that he inhaled some kind of inhalants drug. So let's learn a little bit about inhalants. So what is inhalants? So like Sister Farhanah said earlier, inhalants are breathable substances that induce a psychoactive or mind-altering effects. So one classification system lists 4 general categories of inhalants, which include volatile solvents, aerosols, gases, and nitrite. How the drug works, or we call it pathophysiology of inhalants drug. So inhalants are highly lipid soluble. So they easily cross both alveolar membranes in the lungs and in the blood-brain barrier to reach high concentration in the brain. Inhalations avoid first pass hepatic metabolism, so the onset is fast. Symptom onset is noted within seconds, and the peak plasma concentration occurs 15 to 30 minutes after inhalation. The inhaled concentration depends on the mode administration. Sniffing offers the lowest concentration, followed by huffing, and bagging offers the highest concentration. With a few exceptions, Elimination occurs primarily through the lungs, with many inhaled compound eliminated by exhalation. So some of the inhalants, including alkyl nitrites, aromatics, and methylene chlorides, undergo significant hepatic metabolism that can produce damaging free nitrites and toxic carbon monoxide as byproduct. So what about its absorption rates? So for other small molecules, inhalation is also a fast way to get into the body because drug efflux transporters and metabolizing enzymes are present in the lung at much lower levels than the GI tract. Lipophilic small molecules are absorbed extremely fast. It has a half-life approximately 1 to 2 minutes. Okay, so other than the inhalant drug, we also have assumed that maybe he inhaled marijuana smoke at the illegal party. So this is because we found out that not all drugs that are inhaled will be classified as inhalants. So the topic of this marijuana will be discussed further by the next presenter.
Thank you, Sister Liana. Now I will explain about marijuana. For the definition, marijuana is a psychoactive narcotic drug rendered from the leaf and flowering tops of a cannabis plant, especially cannabis sativa, that is used for recreational or medical purpose by smoking, vaping, or ingesting. It is also known as weed, pot, grass, bud, and ganja. Some people smoke marijuana in hand-rolled cigarette called joints. The main psychoactive or mind-altering chemical in marijuana responsible for most of its intoxicating effect is delta-9 tetrahydrocannabinol or THC, like what Sister Farhanah has said just now. Next, for the retention time, the exact amount of time for a drug that stays in the body varies according to certain factors like the dose, the person's weight, age, gender, and their physical health. However, based on the US Food and Drug Administration, the average time for drug to still show up in a urine drug test is different according to its type. For example, for heroin, 1 to 3 days, cocaine and meth, 2 to 3 days, and marijuana or THC, it takes 1 to 7 days. For the toxic dose level, there are no exact amount that have been recorded. However, the toxic dose of THC in human is estimated for 65 kilogram of a dog would be 8.45 kilogram. Lastly, for the negative effect of marijuana, the short-term effect includes severe anxiety, paranoia, short-term memory problem, hallucination, lower reaction time, increased heart rate, and problem with coordination. According to National Institute on Drug Abuse, THC chemical structure is similar to the brain chemicals, which is called anandamide. Similarity in structure allow drug to be recognized by the body and to alter normal brain communication. Endogenous cannabinoids such as anandamide function as neurotransmitter because they send chemical message between a cell throughout the nervous system. Next, for example, THC is able to alter the functioning of the hippocampus and orbitofrontal cortex in brain area that enable a person to form new memory and shift his or her attentional focus. That's all for me. I pass to the next presenter.
Okay, as mentioned before, marijuana can be used for many reasons, whether legal or not. Yet, no matter how you use marijuana, it can cause immediate and long-term effects on the body. So, for my part, I will explain how marijuana affects some of the systems in the body, specifically on cardiovascular system, respiratory system, and also digestive system. Firstly, for cardiovascular system, chemicals in marijuana are commonly linked to higher risk for heart attack. Some studies suggested that a person risk for heart attack during the first hour of smoking marijuana is about 5 times than his risk, especially if he had a history of heart attack. This is partly because of marijuana can cause accelerated heartbeat and raise the blood pressure within a few minutes after inhaling marijuana. This rapid heartbeat can last for up to 3 hours. Moreover, we can observe that this man is experiencing chest pain and also palpitations as the blood supply is decreased and the oxygen demand is increased. Okay, the second one is on respiratory system. Marijuana smoke, like tobacco smoke, is an irritant to the lungs and can cause respiratory problems such as large
airway inflammation. The risk for chronic bronchitis and also respiratory infections, such as pneumonia, is generally high for people who smoke marijuana regularly. It is because smoking marijuana may reduce the person, may reduce the respiratory system's immune response, and thus the person is more likely to acquire respiratory infections. Besides, smoking the marijuana can lead to 4 times on deposition of tar than cigarette smoking because marijuana smoking often needs to be inhaled deeper and also held for longer. However, in this case, this man does not have any problems with his lungs. The last one for my part is digestive system. If marijuana is taken by inhalation, like this man, it will cause stinging and burning in the mouth and throat while inhaling. On top of that, an increase in your appetite is common when taking any form of marijuana, leading to what many call the munchies. That is why this man feels very hungry because he is experiencing the munchies. Other than that, cannabinoid hyperemesis syndrome is a condition of severe nausea, vomiting, and also dehydration. So this is also one of the effects of on the digestive system. So I pass to the next presenter.
Thank you. Now, the effect on the central nervous system. Commonly, someone will have lack of body coordination, having euphoria, which is getting the pleasure and excitement, delusion, and also lightheadedness. Now, will be looking at the neurological result given in the trigger. But before that, let us know the basic of the test. The assessment can be divided into 5 specific categories, which are the examination on the mental status, on the cranial nerve, motor, sensory, and reflexes. However, it is not compulsory to do all the examination as it can be decided according to the suitability and the condition of the patient. Basically, 2 examination that will be focusing on several aspects such as the level of consciousness, memory, attention, speech, and mood. Then we have the cranial nerve examination that is based on the observation and facial function. In mental status examination, the Glasgow Coma Scale, GCS, is a common scoring system that is used in the assessment of the consciousness level. The score is the sum of the test of function of eye opening, verbal response, and motor response. It is commonly being tested after someone is having a brain injury. The points or score is divided into 3 levels of consciousness. As the higher the score, the better the level of consciousness. The division of score will be as stated in the slide, which is the severe brain injury will have score of 8 or less, while moderate brain injury will have the score of 9 to 12, and lastly, the mild brain injury or trauma will have the score of 13 to 15. The moderate stage and severe stage can cause long-term neurological impairments, while the mild stage may cause a temporary or permanent problems related to the neurological functions and behavior. When someone achieve score of 15, like in the trigger, it does mean that the person is fully awake or conscious. However, the result may not be accurate and can be altered by the presence of drug or alcohol in the body. As in the trigger, the Glasgow Coma Scale result of the person showed a score of 15, which that means he is fully conscious, but the result might not be accurate as he did take the drug. Hence, he has the potential to have a lower score or lower level of consciousness. Next, the cranial nerve examination result. There are actually 12 nerves altogether. The cranial nerve 1 emerged directly from the brain, while cranial nerve 2 to 12 arise from the diencephalon and brainstem. In neurological examination, the term intact supposedly refers to the condition where there are no facial functions problem observed, and hence the cranial nerve are said to be non-impaired. However, the usage of this term has been commonly used among medical practitioners when particular cranial nerve is not examined. Actually, some tests cannot be done as some cranial nerve are difficult to be tested as it has many functions that are related to other cranial nerve. Commonly, the decision will be taken when they already observed that the patient seem to have a symmetric facial function which when they seem to have no problems. Overall, the result of cranial nerve examination in the trigger showed that the medical practitioner did not do the test on cranial nerve 2 until 12 because the male did not exhibit any abnormalities in his facial functions, and it might not be necessary to do that as his facial functions seems normal. Overall, the result of the lung auscultation and neurological examination did not show any abnormalities. Therefore, we can conclude that the symptoms and signs exhibited by the male in the trigger given are caused by the drugs. And lastly, we suspected that the possible drug that have been inhaled is marijuana, as the effects are closely related to this case. It has been recorded several times in Sahih al-Bukhari, narrated by Abdullah bin Amru, that Prophet Muhammad had said, "Your body has a right over you." This tells us that the body has the right to claim over the owner. People have been fighting for human rights, but they do not realize that health and body protection are also part of the human right that should be taken care of. In this trigger, the negligence of that person causes him to be sick, like having palpitation, chest tightness, dizziness, and headache, as stated in the trigger. I think that's all from us. Thank you.